I haven't talked about your pelvic floor in a while, and I just want to let you know, as a women's health physical therapist, that your pelvic floor can be weak or hypertonic, and it can be both. And it can be painful because maybe the muscles are hypertonic and too tight. It can be painful because your tissues are dry. It can be painful because maybe you have a secret labral tear. But your pelvic floor and your hip and your hormones are all interconnected. And when a practitioner looks at you, they are going to look at your hip. They're going to look at the actual pelvis. They're going to check your muscles, your bones, your fascia. They're going to ask about what you're eating. They're going to ask about why it's hurting when you're going to the bathroom, why it's burning. Maybe you have that pesky interstitial cystitis, maybe you have endo, maybe you have scar tissue, maybe you have pudendal nerve pain, maybe you just have leaking because you're in menopause. But they're going to look at the whole picture of you, and this is why a women's health physical therapist could be your best friend. So please don't delay going to the physical therapist for your pelvic issues because you're afraid of them checking your vag. Because technically speaking, if that is what was limiting you from getting the care you need, you can tell them that you don't want anybody to look at your pelvic floor and you just want to have a talk. And talking is one of the best things that we can do to figure out what's wrong with you and to help you figure out a solution. Okay? Don't be afraid. Love you. Bye.